Hello everyone, today we will learn the methods of location acupoints. There are 4 kinds of methods to locate the acupoints. Let's see the content. Methods include the anatomy net markers, the Bodiness measurement, the finger measurement, and the simple measurement. Let's focus on the anatomical net markers on body surface first. It is a method of locating acupoints based on the body surface net markers of human anatomy, and it can be divided into 2 types. One is fixed net markers, and the other one is movable net markers. Fixed net markers are those parts formed by eminence or depression consisting of bone joints and muscles. The contours of the 5 sensory organs, hairline, finger or toenails, nipples, and umbilicus. We can use the net markers to locate acupoints. For example, D25 is on the tip of the nose, RN17 between the 2 nipples, GB34 in the anterior inferior side to the small head of fibula. The second is movable net markers. It refers to net markers appearing under body movements, including space, depression, wrinkles, that appears while joints, muscles, skin, and others move voluntarily. For instance, SI19 is located anterior to the triggers and posterior to the condyle process of the mandible, in the depression formed when the mouth is open. ST7 can be located when we close mouth. LI5 can be located when we tighten up the thumbs. The Bodiness measurement is a method of location acupoints in which the bone segments are taken as main markers to measure the length or width of various portions of the body, and then the length or width is covered proportionally. This measurement is so essential to everyone should master it well. Standards are as follows. In the area of the head and face, the length from the midpoint of the anterior hairline to the midpoint of the posterior hairline is 12 cun. The length from the midpoint of 2 eyeballs, D29, to the midpoint to the anterior hairline is 3 cun. The distance between the 2 frontal angles, ST8, is 9 cun. Distance between the 2 mastoid processes is 9 cun. In the region of chest, abdomen, and flanks, distance from supraesternal fossa to the middle point of the sternociphoid junction is 9 cun. Distance from the midpoint of sternociphoid junction to the sternum of the navel is 8 cun. The length from the sternum of the navel to the superior margin of the pubic bone is 5 cun. Distance between 2 middle margins of the coracoid process is 12 cun. Length between 2 nipples is 8 cun. In the area of back and waist, distance from the middle margins to the posterior midline is 3 cun. In upper limbs, length from the end of the anterior and posterior fold of armpit of elbow creases is 9 cun. Distance from elbow creases to distal traverses waist creases is 12 cun. In lower limbs, distance from the superior margins of the pubic bone to the base of patina is 8 chun. Distance from the base of patina to the tip of patina is 2 chun, and from the tip of patina to the tip of the middle mandibles is 15 chun. Distance from the lower border of medial condylus of the tibia to the tip of medial mandibles is 13 chun. Distance from the great trochanter of the femurs to the popliteal creases is 19 chun. From the gluteal creases to the popliteal transverse creases is 18 chun. From popliteal transverse creases to the tip of lateral minors is 16 chun, and from the tip of the lateral minors to the sole of foot is 3 chun. The finger measurement is the third method, which uses the length or width of patient's fingers as the standards to locate acupoints. There are 3 kinds of finger measurement as follows. Middle finger measurement is the first one. When the patient's middle finger bends, the distance between the 2 middle ends of the creases of the interphalangeal joints is taken as 1 chun. The thumb measurement is the second one. The width of the interphalangeal joint of the patient's thumb is taken as 1 chun. Forefinger measurement is the third one. When the patient's forefingers from the second finger to the fifth finger close together, the width of the forefingers and the level of the transverse creases of the proximal interphalangeal joint of the middle finger is taken as 3 chun. This measurement is also named 一夫法. Simple measurement is the last method, which is easy and convenient to note acupoint in clinical practice. For instance, when the index fingers and thumb of both hands cross with the index finger of one hand stretching, LU7 is in the place right under the tip of the index finger. When you clench the first hollow, PC8 is in the place at the tip of middle finger point. GB31 is located at the tip of the middle finger when you put your finger down naturally beside the thumb. Today, we have learned about the method of locating acupoints. There are 4 types of measurements in total, and the Bodiness measurement is the most important one. Please review all the content and master them after class. Well, class is over.